So much, ma'am. Can you see my screen?
Yes.
Okay. So I'll be sharing the tips for the young FICO surgeons as if how to take control of the errant capsulorhexis. So if you can see this capsulorhexis, so whenever you see a condition like this, that the capsulorhexis is trying to, I think somebody needs to mute themselves. No? If everybody can mute, please. Mr. Sunil, can you mute other participants?
Sure, we can clearly hear you.
Okay, fine. So whenever we see a situation like this, that the capsulorhexis is trying to go radially outwards. So this is the trick by Dr. Brian Littles. First, we go and put viscoelastic in front of the leading flap. We unfold the flap and we try to hold the capsulorhexis flap as close to the root as possible and try to get the capsulorhexis forceps in the center. And you can see this capsulorhexis, it comes back in the path. Now, let's see in the slow motion. I hold it as close to the root as possible and look at the direction of the capsulorhexis forceps. It's going towards center, and always keep an eye on the leading capsulorhexis edge. And you see that this capsulorhexis comes back in the right path. And you can then easily continue by creating your capsulorhexis. So this is the Brian Littles technique of capsulorhexis rescue. I'll be showing one more video to demonstrate that again. So this is another case which had the moderately dilated pupil. And see, and this was a case which had narrow angles also. So the chamber was also shallow. See, when I'm trying to create the capsulorhexis, it's trying to slide and go outwards, and I can't see it clearly. So if you can't see it clearly, don't try to go there and hold the capsulorhexis edge. Now what I'm doing here is I just go there and put some viscoelastic, and because I need a better visibility to hold the leading edge of the capsulorhexis, I go ahead and make one small side port there and use the iris hooks and trying to take the hook the pupillary margin from the area where the capsulorhexis has not gone. So I try to get the iris hooks from this area so that I can clearly see the leading edge of the capsulorhexis. So you can't hold the capsulorhexis edge blindly. Now you can clearly see the leading edge. Again, this direction of the pull is important. It should be horizontal to the capsular plane. And you can see the leading edge is coming back on the track, and you can rescue the capsulorhexis. Again, see in the slow motion, I'm holding it, not pulling it upwards, just keeping it horizontal in the capsular plane and getting the forceps centripetally, and look at the edge of the leading tear that it comes in the right path. And I can see that this leading edge is coming back on the track here. So I think every young phaco surgeon should have these micro forceps in their armamentarium, which can come handy at any time. And then I can easily complete the capsulorhexis.
Thank you very much, Harshul.
And then take off, yes. There will be a small video that I wanted to share with
Thank you. Thank you very much, Harshul.